Welcome to our presentation on human papillomavirus, also known as HPV. I am Lauren and my partner is Maria, and today we're going to talk about a lot of the myths about HPV and the truths. So we do ask that before continuing with the presentation that you guys consider taking our survey. And we've created this survey because, as you can see throughout this presentation, there are many misconceptions about HPV and the HPV vaccine. So we wanted to create this survey originally for UConn students, but we are starting to expand that throughout Connecticut as a whole. And we wanted to see if there were any trends in demographic information with those who have knowledge about HPV and the HPV vaccine, common risk factors, and the vaccine uptake as well. So then hopefully based on those results, we could in the future start targeting those populations and educating them a bit more on this topic. And so as you take the survey, we ask that hopefully you come up with some questions or maybe things you're unsure about. And then at the end, you'll be presented with a fact sheet of HPV and the HPV vaccine. And then also you would continue on with this presentation and learn more about it from us today. And then the other great thing is that if you do take the survey, you will be entered for a chance to win an Amazon gift card as well. So please consider doing that before continuing in our presentation. And you can find that through this QR code. You can scan this QR code or this link here. If it's easier, you can copy and paste that link. So throughout this presentation, you'll see that the QR code is attached to each slide in case you miss it here and you want to pick it up on another slide.
Thank you. Myth 1. People with HPV show symptoms. Truth. Most people with HPV don't know they are infected and never develop symptoms or health problems from it. In 90% of cases, your immune system fights off the infection within 2 years. Myth 2. You must have sexual intercourse to get HPV. Truth. HPV is spread by intimate skin-to-skin contact. While most cases are sexually transmitted, people who hadn't had intercourse can become infected. Using condom helps, but they don't completely protect you against the virus. They don't cover all of the genital skin. Oral sex also exposes you. Myth 3. There are treatments for HPV. Truth. There is no treatment for HPV, but there are ways to treat HPV-related health problems such as precancerous lesions and genital warts. Myth 4. HPV interferes with pregnancy. Truth. In the majority of cases, having HPV does not impact a woman's ability to become pregnant. However, regular screening is important. Becoming pregnant after receiving the HPV vaccine is safe. The vaccine does not affect the fetus. Myth 5. The HPV vaccine protects you for life. Truth. The vaccine is effective for at least 10 years. Doctors are optimistic that it will provide a more long-lasting protection.
Myth 6. The HPV vaccine may cause medical problems and it is not safe. Truth. The HPV vaccine is a safe drug and doesn't contribute to any serious health issues. Like any vaccine or medicine, the vaccine may cause mild reactions. The most common are pain or redness in the arm where the shot was given. Other typical side effects include low-grade fever, headache or feeling tired, nausea or muscle or joint pain, all of which are temporary. Rarely, an allergic reaction can occur, and individuals should not get the vaccine if they are allergic to any of the components in it. The vaccine itself has been researched for many years, including at least 10 years of research before it could even be used in humans, and it is highly monitored by the FDA. Myth 7. You got the HPV vaccine, so you can skip your Pap test. Truth. No, because no vaccine prevents all types of HPV that can cause cervical cancer. Vaccinated women aged 21 to 29 should receive a Pap test every 3 years. Vaccinated women aged 30 to 64 should receive a Pap test and an HPV test every 5 years. And women aged 65 or older should discuss their individual need for screening with their doctor. Myth 8. HPV vaccination can lead to infertility. Truth. Claims of HPV vaccine-induced infertility due to premature ovarian failure have been disproved by research and clinical trials. However, it is possible that the treatment of cervical cancer or precancer could leave a woman with a risk of complications or the inability to have children. Myth 9. HPV is uncommon and it is unlikely I will be infected, so there's no need to get the HPV vaccine. Truth. HPV is the most common sexually transmitted infection. Over 14 million new infections each year in the United States occur. Nearly every male and female will be infected with at least one type of HPV once in their lifetime, and over 80 million Americans are currently infected. Myth 10. The HPV vaccine is ineffective. While it is true that individuals can still get HPV with the vaccine, this does not mean that the vaccine is ineffective. The vaccine is effective for protecting males and females from approximately 90% of HPV-related warts and 70% of cervical cancers. 3 reasons why you might still get HPV even though you have the vaccine are 1, that you might be exposed to HPV before getting the vaccine, that you may be exposed before completing the entire series, 2 to 3 doses of the vaccine, and that you may be exposed to different strains of HPV that are not covered by the vaccine. And we wanted to talk a bit about COVID-19 and what's been going on with vaccination rates during this time. So the HPV vaccine can prevent more than 90% of HPV-related cancers. HPV vaccine prevents HPV infections that can cause 6 types of cancer listed here: cervical, vaginal, vulvar, anal, penile, and oropharyngeal, also known as throat. So those are the common HPV influenced cancers. And what was seen during the pandemic was that there was an 80% drop in weekly HPV vaccine provider orders in March of 2020, and a 73% drop in HPV vaccination in April of 2020 compared to mid-February of 2020, which is quite a decent drop. It should be prioritized for preteens and younger adolescents for whom vaccination is most effective at preventing cancer. Thank you guys so much. This is our reference page. Thank you for attending this presentation. Again, if you would like to fill out the survey, the QR code is up in the right-hand corner. And thank you.